So these are our exam rooms, and we have, patient libraries over here for people to get, information about nutrition and counseling and all that kind of stuff over there.
Oh, wonderful.
A library is a library, an exam room is an exam room, but just an idea of some of the spaces that we're trying to create for people to come while they're waiting or while they're, with their family members. And then all of these areas here are designed, again, trying to get it away from a traditional clinic view.
It absolutely has no feel of a clinical or traditional clinic.
Here's our, we can't film patients, so we'll just have to
Sure.
try not to have it be cubicle-like and, just have different spaces and different comfort levels for people, where they're having to sit here sometimes for our research studies. People are here oftentimes for 12 hours at a time. Now they're going and coming in between, but we want to make sure that they have space for themselves to maybe get some work done or watch TV, listen to music, and they can do. This is the Premier Oncology Foundation, where we're trying to come up with ways of improving cancer care through nutrition education, yoga therapy, art therapy, research about alternative complementary medicine. So this is a space that we're just trying to build out right now. Obviously it's empty, and our director is working on a series of workshops. We have a workshop called Care for the Caregiver. We have a workshop for patients and their caregivers about information on cancer and cancer treatment. And also the Loyola Law School has a program to help patients navigate the legal system, things about job discrimination or re-entry into the workplace, and they'll be doing a workshop for people to learn information about that as well. We have between 20 and 40 clinical trials at a time. Now when I say that, you look at major cancer centers around the country or even around the city, and if you count all of the trials that are just asking patients to fill out a questionnaire, not necessarily linked to therapy, there may be hundreds of clinical trials. But if you look at trials that are specifically designed to give people some kind of therapy or chance at therapy or new therapy, we have among the largest number in the United States, right here in Southern California. And when you add our partners in Arizona and our partners in San Diego, that number gets larger and larger.
Could you explain to me a little bit the word therapy? What does that entail?
All this buzz around the word chemotherapy, that people
Exactly.
are going to get extraordinarily ill and their hair is going to fall out and they're going to get nauseated and they're going to not be able to leave their house. And the new kinds of cancer therapy or cancer treatment, sometimes they're pills, sometimes they're IV. They're designed to focus on the differences between a cancer cell and a regular cell. So if you can focus on those differences, you can attack the cancer, you can kill the cancer, and you can spare the body of the side effects to the normal cells. And so that whole new field, sometimes people use the word biologic therapy, or targeted therapy, or smart therapy. All those things are just different synonyms for treatment that's designed to fix the cancer.
So it is absolutely a total awareness of everything
Right,
in the body and the biology. And
it is, and at the end of the day, what you really are focusing on, in addition to length of life, it's quality of life.
exactly.
And so if we can convert cancers, and many of them, that's actually true right now, from this horrible, deadly disease to a chronic illness like high blood pressure or diabetes, and people can take their treatment, whatever it happens to be, with very few, if any, side effects, cancer doesn't have to shrink. People can live with their cancer for many years. And I think that's where cancer medicine is going. The FDA is there as our ombudsman to make sure that whatever it is we do is safe, that people have the appropriate information to make decisions about their treatment, that there's good surveillance of side effects. Everything that we do has to be approved by the FDA before we even start. If there's any severe reaction, whether it's expected or unexpected, we're required to report that to local ethics committees as well as to the FDA. And before a drug gets approved, obviously there are certain requirements that the FDA will ask for before it'll pass judgment on whether a drug gets approved. So I think it's a very close relationship, but it really is one piece of a very large puzzle.
Be, yeah. And tell me, with your experience and your discoveries, what would you say is the most important element or factor within cancer research, in terms of improvement of cancer patients and survival, that you have discovered over the years?
Let's remember that cancer is really a collection of hundreds of different diseases, yet we all seem to think that cancer is cancer is cancer. So if you look at just colorectal cancer, which is a disease that I've been very interested in, 7 or 8 new drugs have been approved in the last 3 or 4 years. Average survivals for people with advanced colon cancer, cancer that's spread to other organs, have gone from 6 months to 36 months, or should we say somewhere in between 30 and 36 months. Now that's not long enough, to even have say that an average survival is 3 years, but we have more and more patients that are living for 6, 7, and 8 years, and not only are they living, but they're living with great qualities of life. And the combination of chemotherapy or the biologic therapy we've been speaking about, surgeries, different kinds of procedures to eliminate tumors has completely revolutionized care. And that whole adage of making therapy available for people here in Southern California, making it safe, making it tolerable, making sure people have options, it's a completely different world from even a couple of years ago, and it's rapidly changing.
So it's a very positive and almost exciting, pivotal experience to run all those clinical trials and discover things against cancer, even though we can't cure it.
Well, right. I mean, for me to be using the same treatments over and over again, I think would just be dreadful. There's so much room for improvement. And to feel like we in our community have a chance to make people's lives better locally as well as influence worldwide care is tremendously exciting.
In terms of education on cancer, would you say people are aware of certain lifestyles that we can adapt to prevent higher risks of getting cancer?
I think that there's a lot of awareness coming to the public. I think there's a lot of misinformation. I think with the wealth of information that's available on the internet, I think sometimes that it's an avenue for people to be pushing things out there too early. I think one of the jobs of Premier Oncology, and certainly our foundation, is to make education available to everybody, and also to kind of help people decide what information is real and what's not real, and start to do some studies, not just on traditional cancer therapy like we've been talking about, but in the alternative complementary medicine, nutrition education.
Nutrition is very important.
Exactly. It's what they call psychoneuroimmunology. The whole mind-body connection is really important as well. Because again, it's not just about shrinking a tumor. You're talking about treating people, and you're talking about trying to maintain healthy lifestyles and prevent cancer, and that whole field needs to be looked at.
The body, soul, and mind, everything is related, right?
Exactly.
So would there be anything that you would like to say to patients now with cancer, or can you not generalize, because everybody's a unique case?
Well, everyone's, of course, a unique case. I think the important thing for an individual person battling cancer or someone who has a loved one battling cancer is educate yourself. Speak with your doctor about options that are available in his or her office. Speak with major cancer centers that might be closer to your house. Find out about experimental therapies that are available near you. Because what's so important for the generation of people that have cancer now, as well as those that may have cancer in the future, is we have to learn from each individual case right now. That's the only way that we're going to make progress.
So everything is a clinical trial in a way.
Life is a clinical trial.
Exactly. Great. Well, Dr. Lila Rosen, thank you very much.